Welcome to our exploration of genetic counseling, a critical component of modern healthcare. Genetic counseling aids individuals and families in understanding their risk for genetic disorders, which are passed down through families due to changes in genes. Trained professionals, genetic counselors provide information and support, guiding people in making informed decisions about their health. As genetic testing advances, identifying gene changes that can increase disease risk, the importance of genetic counseling grows. Genetic counselors help individuals understand their test results and the implications for themselves and their families. They offer guidance on managing risks and making informed health decisions. The journey of genetic counseling often starts with a referral from a doctor or another healthcare professional, possibly due to a family history of a genetic disorder or personal medical history. The first step is a consultation, where the genetic counselor gathers information about the individual's personal and family medical history, ancestry, and ethnicity. This helps assess the risk for genetic disorders and determine appropriate genetic tests. Once testing is complete, the genetic counselor helps the individual understand the results, their implications for the family, and guides them on managing any identified risks. Genetic counseling offers numerous benefits. It provides the opportunity to understand one's genetic risks, gaining insights into predispositions to certain diseases. Early detection is another significant benefit, as many genetic disorders, if identified early, are treatable or manageable, leading to better outcomes and improved quality of life. Genetic counseling also offers relief and reduced anxiety by providing clarity about one's genetic makeup, alleviating stress, and empowering informed health and family planning decisions. Despite its benefits, genetic counseling faces challenges. The complexity of genetic information, constantly evolving with new discoveries, can be difficult to keep up with and understand. The cost of genetic testing and counseling, though decreasing, can still be a barrier due to varying insurance coverage, preventing some from accessing these services. Additionally, as genetic testing becomes more widespread, the demand for qualified genetic counselors increases, but the shortage of trained professionals leads to longer wait times and limited access to services. Section 5. A powerful tool: case studies in genetic counseling. Case studies illustrate the profound impact of genetic counseling. Consider the story of Sarah, a young woman with a family history of breast cancer. Her mother and aunt were both diagnosed with the disease at a young age. Concerned about her own risk, Sarah sought genetic counseling. Through testing, she discovered that she carried a BRCA1 gene mutation, significantly increasing her risk of developing breast and ovarian cancer. Armed with this knowledge, Sarah made proactive decisions about her health. She opted for increased surveillance and risk-reducing measures, empowering her to take control of her health destiny. In another case, a couple, Mark and Emily, were expecting their first child. During a routine prenatal screening, their doctor detected an increased risk for cystic fibrosis. With the support of their genetic counselor, Mark and Emily made informed decisions about their pregnancy and prepared for the challenges and joys of raising a child with cystic fibrosis. Section 6. The ethical frontier: balancing knowledge and choice. As genetic testing becomes increasingly sophisticated and accessible, ethical considerations surrounding genetic counseling take center stage. One of the most pressing ethical dilemmas is the potential for genetic discrimination. Concerns exist that individuals who test positive for certain genetic conditions may face discrimination in employment, insurance, or other areas of life. Protecting individuals from genetic discrimination is crucial to ensure that genetic information is used responsibly and ethically. Another ethical challenge is the issue of informed consent. Genetic testing reveals sensitive personal information about an individual's health and future risks. Ensuring that individuals fully understand the implications of genetic testing and are empowered to make autonomous decisions about their health is paramount. Genetic counselors play a vital role in facilitating informed consent by providing comprehensive information, addressing concerns, and respecting individual values and beliefs. The use of genetic information in reproductive decision-making also raises ethical questions. Pre-implantation genetic diagnosis, PGD, allows parents to select embryos for implantation based on their genetic makeup. While PGD can prevent the transmission of serious genetic disorders, it also raises concerns about designer babies and the potential for genetic enhancement. Section 7. Advancements in genetic testing, expanding the counselor's toolkit. The field of genetics is rapidly evolving, with new discoveries and technological advancements emerging at an unprecedented pace. These advancements have significantly expanded the toolkit available to genetic counselors, providing them with more sophisticated tools to assess genetic risks, diagnose genetic disorders, and guide individuals and families in making informed decisions about their health. One notable advancement is next-generation sequencing, NGS, a technology that allows for the rapid sequencing of entire genomes or specific gene panels. NGS has revolutionized genetic testing by enabling the identification of multiple genetic variations simultaneously, providing a more comprehensive view of an individual's genetic makeup. This technology has proven particularly valuable in diagnosing rare genetic disorders, identifying disease-causing mutations, and guiding personalized treatment plans. Another significant advancement is the development of non-invasive prenatal testing, NIPT, a screening test that analyzes fetal DNA circulating in the mother's blood. NIPT can detect chromosomal abnormalities, such as Down syndrome, with high accuracy, providing expectant parents with valuable information about their baby's health early in pregnancy. Direct-to-consumer testing, a double-edged sword. The rise of direct-to-consumer genetic testing has democratized access to genetic information, allowing individuals to order genetic tests directly from testing companies without a healthcare provider's involvement. While DTC testing offers potential benefits, such as increased awareness of genetic risks and empowerment through knowledge, it also raises concerns about privacy, confidentiality, and the interpretation of genetic information. One of the primary concerns surrounding DTC testing is the potential for misinterpretation of test results. Genetic information can be complex and nuanced, and individuals may not have the necessary knowledge or expertise to interpret their results accurately. This can lead to anxiety, confusion, and inappropriate medical decisions. Another concern is the potential for privacy violations. DTC testing companies collect sensitive personal information, including genetic data, and concerns exist about the security and confidentiality of this information. It is crucial to ensure that DTC testing companies have robust privacy policies in place to protect individuals' genetic information from unauthorized access or disclosure. And genetic counseling and the future, a paradigm shift in healthcare. Genetic counseling is poised to play an increasingly prominent role in healthcare as our understanding of the human genome continues to expand. With the advent of personalized medicine, healthcare is shifting from a one-size-fits-all approach to a more individualized model tailored to an individual's unique genetic makeup. Genetic counseling will be instrumental in guiding this paradigm shift, providing individuals with personalized information about their genetic risks, guiding treatment decisions, and empowering them to take control of their health. One area where genetic counseling is expected to have a significant impact is in the field of oncology. As our understanding of the genetic basis of cancer grows, genetic testing will become increasingly important in identifying individuals at increased risk of developing cancer, guiding cancer screening and prevention strategies, and tailoring cancer treatments to an individual's tumor profile. Genetic counseling will also play a crucial role in reproductive health. As genetic testing becomes more sophisticated and accessible, couples will have more information about their genetic risks and the risks they may pass on to their children. The importance of accessibility, bringing genetic counseling to all. As genetic testing becomes more widespread and integrated into healthcare, ensuring equitable access to genetic counseling services is crucial. Currently, access to genetic counseling is often limited by factors such as geographic location, socioeconomic status, and health insurance coverage. This disparity in access can exacerbate health inequities, as individuals from underserved communities may not have the same opportunities to benefit from genetic information and counseling. Expanding access to genetic counseling services requires a multi-pronged approach. Increasing the number of trained genetic counselors is essential to meet the growing demand. This can be achieved through expanding genetic counseling training programs, providing financial incentives for individuals pursuing careers in genetic counseling, and exploring innovative models of service delivery, such as telehealth. Increasing awareness of genetic counseling services among healthcare providers and the general public is also crucial. Conclusion: embracing the power and responsibility of genetic knowledge. The field of genetics is rapidly advancing, unlocking the secrets of our genetic code and providing unprecedented insights into our health and well-being. Genetic counseling stands at the forefront of this revolution, empowering individuals and families to navigate the complex world of genetic information and make informed decisions about their health. By promoting access to genetic counseling services, ensuring responsible use of genetic information, and fostering ongoing dialogue about the ethical considerations surrounding genetic advancements, we can harness the transformative power of genetics to improve human health and well-being for generations to come.